Welcome to Majlis podcast by Emirates Hospitals Group. Our goal at Majlis podcast is to update you with the latest advancements in medicine in order to improve health and well-being. My name is Dr 𝗍𝗶𝗀 𝗪𝗀. I am a consultant pediatrician at Emirates Specialty Hospital in Dubai, and I am the host of Majlis podcast. Heart health is a top priority for all. For this, today my guest is Dr Layal Abdallah. Dr. Layal, I will leave you to introduce yourself to the listeners of Majlis podcast.
Okay, thank you, Dr. Wafa. I'm Dr. Layal Abdallah, Consultant Interventional Cardiologist in Emirates Hospital Group, Jumeirah branch. I'm French board certified. I was specialized first in echocardiography and then in interventional cardiology in France and in cardiology and sport in France. And then I started since October in Dubai in the Emirates Hospital.
Thank you very much, Dr. Layal. Such a great profile, really. And I think we are lucky to have you in Dubai and particularly in Emirates Hospitals Group.
Thank you so much.
Thank you very much for being with us. So we want to talk to you about the heart diseases in general. What is heart blockage, for example, or heart block, and why this can happen to the people?
Okay, so the coronary artery disease is the deposit of the cholesterol, the plaque of the cholesterol in the lumen of the coronary artery, which will create a narrowing on the coronary artery, and this will compromise the perfusion of the heart muscle. So we can have multiple factors that it can give the narrowing on the coronary artery, and this factor we called the cardiovascular risk factors. The main important cardiovascular risk factors, we have the hypertension, we have the diabetes, the hyperlipidemia, the smoking, and we have also the overweight or obesity. And we have some factors that we cannot change. That means that the family history of cardiovascular disease at young age and the gender, the male patient, are more risky to have cardiovascular disease. And also we have the ethnicity. There is some population that there are at high risk of cardiovascular disease.
Okay. So what are the symptoms that if someone starts to have, should seek medical advice or should go to the cardiologist?
Yes, the main symptoms is the chest pain, and usually it's a retrosternal chest pain in the middle of the chest. And this pain can go to the neck, to the jaw, and to the left arm. After, also, we can have the shortness of breath. And we know that the female patients have usually more shortness of breath than the chest pain. And we can have also the problem of palpitation or the problem of nausea, vomiting, epigastric pain, stomach pain, and we can have the problem of dizziness. Sometimes the fatigue, the important fatigue for the small exercise, is important also to take in consideration.
Okay, that's great. So like if someone did not have these symptoms, but as you know, like we are growing, and for example, is there any advice for screening in general at a certain age, for example,
yes,
like other conditions?
Yes, the screening for all the people, it will start for the male after 40 years old and for the female after 50 years old or after menopause. Okay. Or if we have one risk factor.
Yes.
When we have one risk factor, we need to have the checkup.
Yes, that's brilliant. So really, there are some people maybe who don't have symptoms, so they want to make sure that their heart is fine and in good health. So you answered our question that yes, there are certain screenings can be done. So now, unfortunately, someone gets the heart disease. Let's say we are speaking about now heart block. So we hear a lot about stenting. So is it the only option for treatment, and what are the different types of treatments available for
Okay. The stenting is the most important option for treatment for the coronary artery disease, but it's not the only treatment. Okay, we can have the medical treatment, we can have the stenting, and we can have also the heart surgery. So for the stenting,
because you are an interventional cardiologist, so that's why we want to know about stenting from you.
Yes. So there is some condition that we need to take in consideration to see if we can put a stent for a patient with the blockage, or if we have the indication to put the stent. So we have these factors that we should take in consideration. The first thing is in which condition the patient will arrive to the hospital. Yes. Are we in emergency case? That means he is doing acute coronary syndrome or unstable angina. And here it's important to put a stent, because putting a stent immediately will open the artery, and we will have the flow of the blood directly to the heart muscle, and we will decrease the risk of damage on the heart muscle. After also, we need to see what is the size and what is the degree of the blockage. That means when we have a severe blockage, more than 70%, we need to treat it, especially if we are talking about the main arteries and the arteries of big or intermediate caliber. Yes. We should also take in consideration if we have between 15 to 70 degree blockage, if we are doing a testing on the arteries, and this testing with the technique of FFR, and we will see if the blockage, we need to consider it as severe blockage, also significant blockage. After also, we need to see if the patient will have good response to the medical treatment. When we are in stable angina and we start the medical management, and after the medical management the patient still have pain, that means that we need to treat it with stenting. And also we have to do the test, some testing for the patient, especially the exercise test, and we will see if we have severe ischemia. If we have severe ischemia on the heart, that means that we need to put a stent. The also thing that we should take on consideration is it easy to put the stent? Sometimes we have some tortuosities in the artery. It's not so easy to do it. So we can prefer the other options. And also we should see if the health, general health for the patient, is he able to tolerate a cardiac surgery or not? Because if he can't tolerate the cardiac surgery, we need in this case to put the stent. So there is multiple factors that we should take in consideration before telling the patient or propose to the patient what is the best treatment for him.
Unless it's an emergency situation, then you have to do what you have to do. Yes. So with the advancements now in medicine and in science, do you see a difference between stenting nowadays and the stents that were used, for example, in the previous days?
Yes, for sure, because at the first, when we started the stenting, it was the stenting that without the medication. And with this stent, we usually have restenosis on the stent, and we have to take the patient multiple times. Now we have what we call the drug-eluting stents. That means that we have a stents with medication, which will avoid to have the restenosis in the stents. And now the characteristics of the stents is better and better, because the stents now is going smoothly in the arteries. So we have less complications. So all the techniques for the stents are improving, and also we have some techniques that it also will help us to prepare correctly the artery to put a stent and to have a very good results after stenting.
So science is helping in making the life better for these people who require stents in the field of coronary artery disease. So regarding this is like out of curiosity. So when you say 70% blocked artery or something, this is you diagnose this through the cardiac cath that we do, the test that you do?
With the cardiac cath, or what we call the angiogram. So it's a procedure that we will do. We will
Is it an easy procedure or?
Okay, it's invasive procedure, but now it's easy to do it, okay?
Yes.
Because now usually all the procedures that we are doing, it's through the radial arteries. So we do a puncture on the artery, and we will put the wire to go through the arteries of the arm until the aorta, and then in the coronary arteries. Yes. And then we put the contrast in the arteries, and we see exactly where is the blockage and what is the degree of the blockage. And here we can have the idea if what's the treatment that we should do for the patient.
Yes. And there is nothing non-invasive like MRIs or like that, like getting into the picture?
We can do the CT scan for the coronary arteries. Sometimes it's not very accurate. So if we have a severe stenosis on the CT scan, we should go to the angiogram.
Yes, okay. So great. Now we want you to give us, like, from your opinion, the major differences between the stenting and the bypass surgery. Because people maybe would say, why I don't do the surgery? And what's the major differences between these two?
So the indication is not the same, and also we should take on consideration that the surgery is not so easy to do. So just to explain, because the cardiac surgery, we need to open the chest and to stop the heart, and then we will the patient will be related to a machine. This machine will give the blood to the other organs, and then the surgeon will prepare what we call the bridge. So it's an artery or vein that he will take it from the leg or from the chest, the mammary arteries, and the mammary arteries. So it will he will take a bridge from the subclavian artery to the distality of the arteries, the coronary artery. It's a big surgery, and that means that the patient will be in admission in the hospital for at least 10 days, and he needs after to have the rehabilitation.
Yes.
So it's a big surgery. The risk of complication are also high. So we know that when we can do the stenting, we will do the best
option, of
this
course.
Is the best option. Yes. But sometimes we have some indication that we cannot. Yes. And especially when we have difficulties to reach the stenosis. That means that we can have very high tortuosities, important tortuosities on the coronary arteries, or very high degree of calcification. And when we have a lot of calcification, we know that we cannot open correctly the stents.
Yes.
After also, it depends on the position of the narrowing. If we have multiple narrowing diffuse disease on the coronary artery, we cannot put 10 stents on the artery. So we should go to the surgery. And if we have also the stenosis on the left main with other artery, it's preferred, especially for the diabetic patient, to go to the surgery.
So, so much information, great information and insights from you, Dr. Layal. My last question will be, I mean, since cardiac diseases and coronary artery disease is the leading cause for death, and we want really to live, we want all the people to live and enjoy a great health. So what's your advice for those people who might maybe now having blood pressure, high blood pressure, a little bit of maybe a sedentary lifestyle, maybe some overweight, or maybe a type 2 diabetes at an early stage, or any risk factor, let's say? Or maybe just aging, but like they are not into a very healthy lifestyle. What's your advice to them from an interventional cardiologist like you? What do you tell them?
Okay, there's 2 points that we they should have. The first thing, the prevention is the best way to treat. So when we have risk factors, we should treat the risk factors as early as possible, that we can avoid to have the coronary artery disease. So for these people, we need to have, or for all of us,
yes,
we need to have we need to have the healthy diet, okay, with fruits, vegetables, fish, chicken. Avoid to have red meat, avoid to have fatty milk or fatty foods. So we should take healthy diet. And then after, do exercise. It's important to have the exercise, because the exercise will reduce the blood pressure, will reduce also the level of sugar in the blood. So it's important to avoid to have the coronary artery disease. After After the prevention also, if we have a problem on the coronary artery disease, it's important that we treat early the coronary artery disease. When we are starting the medication and the medical management for the coronary artery disease, we will avoid to have the progression of the coronary artery disease and avoid to have the acute coronary syndrome and avoid to have stents. So it's important to have the checkup for all the patients that have risk factors, that we can detect the coronary artery disease as soon as possible and start the medication and also change the lifestyles.
So thank you, Dr. Layal Abdallah, for this great information about the health of the heart. And we wish all our also listeners a healthy life and a healthy heart as well. And stay with us for coming episodes.